different TMFs are used. And an alternative is developing logic models, because it's not a guarantee that any of these TMFs is fully suitable. And which finally, a not so serious TMF quiz. I think you have learned through this hour how to differentiate them. Okay, so let's start with this taxonomy. And most of it is based on this paper, which is my sort of one-hit wonder, the only paper I've done which has been read by quite a few. So it clearly showed, actually it was prompted by the course. The students asked, how do we bring some order to these TMFs? So it's important to separate these three categories. So TMFs or theories, they imply some predictive capacity and importantly try to explain the causal mechanism. That's not the aim of models in implementation science. They're usually intended to describe and or guide the process, the implementation process. So it's a different aim. I'm not seeing the slides. Are you seeing the slides?
I see the slides, Per.
Yes, yes. It's okay now.
Sarah doesn't.
That's okay. I'll work on my side to fix that. Don't worry.
Are you seeing them, Vincent?
Yes, yes.
Okay, I'll carry on and we have to solve that. And then we have frameworks, which are sort of more basic. They just identify a number of factors believed and or found to influence implementation outcomes. So models and frameworks, they do not specify these mechanisms of change. They're more like checklists. And I came up with this simple figure to show how we distinguish between theories. And theories usually have this sort of layout. Knowledge influences intention to act, and then you have an outcome. Whereas frameworks only identify a number of factors, do not really go into the interrelationship between them. So let's start with process models, which I think can be quite useful and quite a few in our course use to guide implementation. So as I said, to describe and or guide, they are sort of the more practical tools, the how to implement. And here is a good example, which is quite popular and which Margit and I have developed into an AI quiff, because AI is emerging as a really a tool which is increasingly implemented in healthcare. And this model specifies a number of activities, and we believe many of them are relevant also for in an AI context. So it shows the different phases, and I think it's noteworthy that the phase 1 and phase 2 is something you do before the actual implementation. So it's only in phase 3 that implementation begins. And I think that's the ideal, because we find that oftentimes implementation is initiated without all this preparation. So this is a good example of a process model. It's sort of a checklist that you go through these activities. Here is another, maybe more overarching, and starting with knowledge creation, that you have an issue and you do knowledge synthesis, etc., in this triangle. And then the cycle, the action cycle, is more similar to other process models. One of the earliest, I think there is published before 2006. Okay, that were the process models and determinant frameworks. Very common. And you can see that they describe general types, classes or domains, different terms are used, of determinants. And determinants are what we usually refer to as barriers or facilitators. Here is a good example, highly applied theoretical domains framework. And this is sort of a compressed, because version of a number of psychological social cognitive theories, identifying, I think it's 14 domains or types of influences. And you can probably recognize that it's from a psychological point of view, i.e. focus on the individual, although it also addresses social influences and environmental context and resources. But these determinant frameworks differ quite a bit in where they put the emphasis. Here is, I think, the most widely used of all. Consolidated framework for implementation research, SEPHIR. And this is more overarching. It talks about, I think it's 5 or 6 domains, inner and outer setting. The individuals involved are going to influence implementation. The intervention, what you implement, is another obvious influence on implementation success. And then they talk about process, the act of implementing. And here is the most overarching determinant framework, which only talks about 3 factors influencing implementation outcomes. So that's the quality or the nature of the evidence, and the context, and facilitation. So this is based on facilitating the implementation. So implementation outcomes is a product of these 3 factors, these 3 determinants. And we often use this in our course because it's sort of a synthesis of a large number of determinant frameworks. Because if you boil it down, if you say that in English, you end up with these factors. Implementation success is going to depend on what you implement, which we refer to as implementation object, although it's not necessarily a concrete object. Rather, it's a practice, routine, way of working, etc. The adopters will have their say, with highly autonomous professions in healthcare. This is obviously an important factor. And then we have the strategies to support implementation, which is called facilitation in the Paris framework. And then we have this huge and challenging aspect of the context, which can be many potentially critical influences on the implementation. And maybe we should have a fifth black dot in patients, because patients also can influence what is implemented, but not all determinant frameworks include patients. Maybe somewhat surprisingly. So this is sort of a synthesis of a number of determinant frameworks. And the classic theories, which I came up with that name because they had to be called something, but other than being implementation, theories, because these theories were developed in other fields. And so examples from psychology or health behavior, theory of reasoned action, theory of planned behavior, and you can see by the layout that they are theories. They specify the causal mechanism. Very similar. So implementation theories, they were developed, you could say, from scratch within implementation science to try to capture the specifics of implementation developed within the field. This is quite popular, normalization process theory. I think it's quite complex. It emphasizes that it does not address behaviors, but rather not what people say they do or measure attitudes, etc., but rather the work people do, the effort people do when something is implemented. So it's probably more of a sociological theory. Quite popular, I think. And here is more, I guess, with a psychological background, the COM-B, which essentially says that behavior, the outcomes is a product of capability, motivation, and opportunity. And it's a theory because you can see these causal arrows going in different directions. And this COM-B is often can be used together with TDF. So the three components here can be mapped onto the domains of TDF. They were developed by the same team in England. And evaluation frameworks, although it should be pointed out that all of these previous models and frameworks and theories can be used for evaluation purposes. But a couple were specifically developed for evaluation purposes. So evaluation frameworks provide a structure for assessing implementation. And REAIM is probably one of the most widely used, and it emerged in, the background is in public health, and it tried to capture more than effectiveness, because a public health intervention might have small effects, but if it reaches a large population audience, it could still be said to have a considerable public health impact. So it was Russell Glasgow and colleagues who developed this. And then it talks about the adoption, implementation, and maintenance. Also, I would say probably the most widely used, but it does not have an implementation background. The background is in public health. And this is what we always refer to as the implementation outcomes, and that could be a lecture of its own, because that is a challenge in implementation science. What outcomes are there and how should they be measured? And this was developed by Enola Proctor in the USA. And the implementation outcomes she specifies are these 8 types of outcomes. Acceptability, what you implement, its acceptability can be measured as an outcome, because acceptability and appropriateness and feasibility are seen as prerequisites to achieve successful implementation. And then I guess adoption is the most common outcome. Costs, I think, increasingly is emphasized that we should also account for. Penetration and the sustainability is the long-term outcomes. And fidelity is the extent to which implementation adheres to a protocol or something similar. The service outcomes are different types of outcomes at the health services level, and then patient outcomes. So, as you can see, there are a lot of TMFs. And the question is, what might be most relevant for one's own study? Because they have different aims. So when do we use the various TMFs? And 5 common situations in our course I will describe. So situation number 1 is when we are going to implement something, but we should do this, what we call a diagnostic analysis before implementing an evidence-based practice. So what's this? Okay. Then you should use the aim is to understand the conditions for implementing something. And you need to know the barriers and facilitators for designing, developing some sort of strategy. So this is before implementation. And I would say that most commonly one would use a determinant framework, Zephyr or TDF or any of these, to identify various facilitators. We often do this with qualitative approaches, interviews. It's also important to consider that different stakeholders might have different point of views of what the barriers and facilitators are. You could also use classic or implementation theories if you want to understand the change processes, mechanisms. But I would say that the most common here is use a determinant framework. And of course, this should be conducted before planning and executing an implementation endeavor. So the next situation of also quite commonly in the course is that you're planning or supporting an implementation of something. So the aim is to plan and or support implementation. And what activities as part of this a strategy should be undertaken. And here it's the ideal use of process models to plan and execute the activities to be that need to be undertaken. And for example, QIF or knowledge to action. I would say that QIF, Quality Implementation Framework, is probably the most comprehensive and detailed process model. And yes, you could use an evaluation framework to plan the evaluation of this implementation, but you could also use the process model. The activities could be evaluated in terms of the extent to which they were carried out, for example. Situation 3, we have something that is going to be implemented, and you as a researcher is an observer. And you are interested in the determinants, various facilitators, but also the outcomes of this implementation effort. And here is a case where you can use more or less everything, but it's not an obvious case for a process model, but all the others. And I think this was not so necessary to separate because you can use the same. But here's the case where researcher is involved in controlling, for example, comparing two strategies or comparing a strategy with implementation without support, because it's the same case. You use the same TMFs. And then we have the case number 5. Something has been implemented, and you, in looking back retrospectively, want to know how or why did it go as it did. And this is also, I think, an interesting case. A challenge here is recall bias, and do you have data for everything? But here the aim is to assess what activities and or strategies were undertaken, how well were they done, and how to what extent did they influence the outcomes. So here a process model, you could assess retrospectively to what extent and with what quality a number of activities were undertaken. You could also use determinant frameworks, classic theory, or implementation theory to try to understand what influenced the implementation outcomes, the sort of causal mechanisms of what led to the outcomes. And yes, so here you can use everything, essentially, also an evaluation framework, although I would say that if you use a process model, it is also inherent evaluation framework. So now we've gone through all this plethora of TMFs, and they are, you could say that they haven't taken a deductive approach. You have something that you use, analyze data, but you could also develop and investigate, explore implementation inductively, sort of more bottom up. And there's been comments on this. I think there is much fewer papers where this is done. We have even done papers taking this approach where we have been requested to you should apply this or that determinant framework. So I think there is sort of a bias towards using existing TMFs. That's my experience, but I agree with this comment that we need also to be critical as researchers, and not all TMFs are a perfect fit. So instead of taking the deductive route, theory and the observation and confirmation, etc., we do this the other way around. We start with our observations, and we often do qualitative studies on, for example, barriers and facilitators, and then you qualitative content analysis, patterns or themes or categories. And I think logic models is a very good tool. I think especially since there's an increasing emphasis on user involvement or stakeholder involvement. And I think it's a pedagogical tool where you can show and you can discuss, do you agree that A leads to B, or etc. I think it's a transparent process, and I think it's a good way to reach consensus, if there is, because my impression is that stakeholders could have take different viewpoints. So it might be relevant with two different logic models. And I think this is a good compromise, but compromising in a positive sense, because it starts from left. The determinants are based on Zephyr. And the challenge I mentioned is matching determinants with strategies. And it's also a challenge to identify the mechanisms of implementation strategies. Let's say that knowledge is for the individuals, knowledge lacking, skills lacking, then implementation strategy would be probably a course, some training. And then we have the issue of what are the mechanisms of training that leads to the desirable outcomes. But this, I think this is sort of combining a structure, because the outcomes are from Proctor. So you combine actually Zephyr with Proctor, but what you fill in there is what is specific for your case. So I think it combines a deductive approach, a structure, with an inductive approach specific to the case. And I was part of a project deals with how primary care is taking care of mental health problems. And we started by identifying the problems. the current state of mental health care in primary care, etc., etc. And then the intervention here is really a way of working, but it's called integrated behavior health, which is using more psychologists and behavior science practitioners in primary care. And then we discuss what are the strategies, and we could identify, because this is I would say also that this is a project where we as researchers are observers. This has been decided, the intervention and the implementation strategies essentially been decided by the county council, which provides healthcare here. So our aim, our effort is focused on what are the outcomes, and we have also included staff outcomes, but implementation outcomes, service outcomes, and patient outcomes you recognize from Proctor's outcome framework. So I think this is a good way of illustrating, and this has been group discussions involving those who work with this model, integrated behavior health, so that I think we reached consensus on what influences what, the logic model. So I think I usually take too much time, but now there is time over left. So maybe we could, if you all respond in the chat. So my first question here is, how do you categorize the following TMFs? And what is the Stettler model? See if we can get some comments. And it's quite anonymously now because I don't have any pictures. So this starts from left. Yeah, feel free to type your answers. And it goes through a number of stages. And I think it ends with evaluation, but it's going through a number of activities you should carry out. This is an early one. I think it's this is a later revision, but it's actually, I think, from the 90s. Even before we talked about the implementation science, we talked about knowledge utilization within nursing, and they developed several of these TMFs. Can we get any responses? Or guesses? Yes. Chen Chung, process model, and Lim Ye Yong. Yes, this is a classic process model, and they can be really intricate and almost impossible to follow. Here, I think it's sort of not used, you stop there. It's sort of a, yeah, it describes a process where you can actually stop if evidence is too weak, etc. But it's a process model, so that's full points for that. And then we have social cognitive theory. I would like to know what is the implementation strategies. Yes, this is a classic theory. It is one of the most widely used. The implementation strategies, I think we need another session on, but the strategies, we call them strategies in implementation science. They would be called interventions in if we do research on patients and patient outcomes. So we have sort of made a decision that we talk about implementation strategies, i.e., for example, training or financial incentives. You could also say that clinical guidelines is a strategy, i.e., the efforts to improve, facilitate implementation. Those are the strategies. Okay, two. So what might this be? The organizational readiness for change. I'm not sure if there's only one answer. Yes, it could be, but I think they have make the claim that this is, yes, an implementation theory. I think, yeah, because it was developed within implementation science, but that's not so obvious. But it's essentially saying that with change commitment and change efficacy, you are that's what matters for successful implementation. Maybe that was not the best example, I think. So what is this then? Exploration, preparation, implementation, sustainment, EPIS. It talks about these 4 phases, and it talks about outer context, etc., etc. This is a little bit tricky one. Any suggestions? Yeah, Chelmanton. Okay, I can get back to COM-B then. Yeah, so this is a determinant framework combined with the process model approach, because you have these 4 phases where you start with the exploration. It's quite similar to QIF, quality implementation framework. But in each phase, there might be different determinants. So it essentially combines a process to time perspective of a process model with the determinants, the various facilitators from a determinant framework. So I would say it combines the two. I think yeah, we can get back to COM-B. And then what could this be? As you can see, it's a sequence. Starting with discovery research and phase 4. Yes, Jason Lam. I would consider this a very sort of overarching, not very specific and quite early process model, identifying these 5 stages. So this was actually, but I will, I have some time left, but just, I wanted to show this, that I found this on the internet. Where to start? There are so many. This is the segue to the next section, but let's back up to COM-B and see if we can make sense of that. I think the picture is, because we have it, yes, here. Okay, so it talks about these three components: capability, motivation, and opportunity. They, in various combinations, influences behavior. And each of these three components is made up of two subcomponents, you could call them. For example, take motivation, and they talk about reflective motivation, which would be the more consciously cognitive effort, and they talk about automatic motivation, which they sort of liken to less conscious motivation. It's like habits. And they talk about opportunity. It might be physical, it might be social. So they're essentially taking these three, COM, and broken them up into two different types of each. And you can see that the arrows are going back and forth. It is noteworthy, I think, that behavior also influences opportunity and also influences capability. So it's not only one directional. Yes, I can share these PowerPoints. So I think, do we have any questions, or should we maybe save them for after? Because I'm sure this is quite confusing. But you're not alone in thinking that. Okay.
Okay, so thanks very much for Professor Nilsen for his excellent lecture. Is there any questions that the audience want to ask Professor Nilsen? So please feel free to type in the chat box.
And maybe I should mention, Vincent, today I talked with EKEO and others. And they are using, one project they're using this combined logic model with Zephyr and Proctor, and another used Zephyr. So I can see that many here are very sort of becoming experts in the use of many TMFs. It was quite nice. Yeah.
Yeah, I do agree, especially when we are tackling with very complex implementation issues. So when we have different perspectives, by combining different types of models or frameworks, we will be able to dig deeper on understanding the issue and translate that into better implementation interventions design when we have different perspectives. So
Yeah,
I've got,
just a final comment is that I think essentially what these TMFs do is that they provide a structure. And as you say, especially there were some really challenging, complex projects here. I think they are a help, that they guide the researcher a lot. So I think they are, even though I'm also an advocate for sort of bottom-up inductive, I think these TMFs are really important and helpful.
Okay, we've got one questions from Professor Jin Kim. She's asking, with so many theories, how do researchers in the field go about choosing the most appropriate one? For example, which component of the TMF is considered to be most important to focus on, typically when you have so many different theories and things? But probably that relates to the next talk as well. So,
Yes,
Professor Nelson, do you want to respond?
No, I think actually that question is, I think Margit and Sarah will clarify that. But another was, can you please use lay language to explain the difference between theories and frameworks and models? And I would say, yes, lay language, but theories have the highest ambition to explain the intricacies and the complexity of what A influences B and B might influence C, which might influence implementation outcomes. frameworks is just a list of factors that might influence. So they are simpler, and the models, they have this time perspective. So an added difficulty is that some call it, even if it's a model, they call it a framework and vice versa. So I can totally understand this confusion, and I'm not sure if I managed to reduce it. But I think the challenge of choosing is also what we struggle with, and I think maybe an all too common solution is that we take the most commonly widely used and have that as an alibi. Well, many others have used it, so it seems okay, without sort of providing much more arguments. But I think Margit is prepared to solve these questions.
Okay, so probably now we can introduce the next talk. So up next, we have a joint presentation from Professor Sarah Birken and also Professor Margit Neher. Professor Sarah Birken is an associate professor in Department of Implementation Science in the School of Medicine at Wake Forest University School of Medicine and a member of Comprehensive Cancer Center. Her research focuses on translating evidence into practice, including studies on middle managers' role in implementing evidence-based practices, the implementation of innovations in cancer care, implementing care coordination initiative, and also selection and application of implementation theory. And also Professor Margit Neher is a senior lecturer in implementation science in Hampstead University. Her research focus is on the implementation of diverse clinical interventions within cardiology, cancer rehabilitation, and family health promotion. Her current research addresses challenges related to the complexity of implementing information-driven healthcare solutions, including AI system and applications. Her research has also relates to the learning process related to changes in individual groups and organizations. So now may I invite two professors to start the presentations.
Thank you so much, Vincent. I quite enjoyed being invited to be in this seminar series, and it will be so interesting to see if we can contribute anything to lessen the confusion that may have occurred earlier during the day.
Thank you.
I myself, I don't have to present myself, and I don't think Sarah needs any further presentation. So shall we just dive into the PowerPoint? Let me see where that is. It's here.
Down there at the bottom, but you can share. Yeah.
So I think that maybe it will so soon pop up on your screen.
Yes, I can see your slides, but yeah.
Okay. So
You can
Sarah
change
and
it
I
to
will.
you can change it to the presentation mode.
Yes, I think I tried to do that, but something happened. Okay, I'll try again.
Yeah. Just wait for a moment. Sometimes it takes time to load when you change to the presentation mode. Yes, excellent. It's very clear now.
I'm happy it worked across all these seas and countries as well. So we're going to share some of our research experience with the students and teachers that are listening to us today. And I will be leading this session, but I'm very happy to have Sarah by my side because she has a very extensive experience of using theory in her research. So together we will try to help you through some of the of the topics that you see on the screen. The first one will be about using theories, models, and frameworks in implementation science research, and it's very closely connected to what Professor Per Nilsen just talked about. And then we're going to present a tool to you that will help you to select these TMFs. So that will be a direct answer to one of the queries we've seen earlier before in this earlier presentation. Then we will go through some of the ways that you can use theory in research and give some examples from our own experience. And at the end of the session, we'll hope to wrap things up, but there will be time for questions, as I understand it, after our presentation. So, Sarah, I'm going to ask you some questions now just to warm up in this particular topic. And my first question is, how important are these theories, models, and frameworks in your research practice, Sarah?
Well, I hope they're as important as they are for anybody's work. For me, I view theories, models, and frameworks as the mechanism through which researchers accumulate evidence about the way the world works. So we have these ideas, these TMFs that scholars put forth as ideas about how we think things work, whether it's a framework which identifies a series of things that may be associated with implementation, or a model which demonstrates kind of the path through which things are implemented, or a theory which talks about how or why something is implemented. And by using a theory, model, or framework, I'm saying, I think this is approximately how things are going to look when I do the research. And then when I do the research, I have this counterfactual for the evidence that allows me to determine whether or not, or to what extent, that theory, model, or framework holds up. And in many cases, there's discrepancies between that theory, model, or framework and the evidence that I gather. And that's really interesting, because then I get to think about why that might be, and develop the theory, model, or framework a bit. And that way I can work with colleagues who maybe are in the field of social work or education, and we can kind of cohere evidence across lots of fields, all related to implementation.
I thought it was so interesting that you were also very sensitive to a theory not being complete and to adapting it to a new context, etc. And I think that that's exactly the way I would like to see theories and models and frameworks used, because we're learning all the time and the contexts aren't the same. So maybe some of the factors that are present in our theories do not really mirror what we're encountering in the real world. That was so interesting. Yeah, isn't it? Is that what makes research fun as well?
Yes, and thinking about how, sometimes one TMF isn't enough and we need to combine them, or we need to use parts of them. I like to say TMFs should not be an albatross around your neck. It shouldn't be something that weighs you down or is a burden. It should give you wings. It should give you the ability to think more expansively about things. And you shouldn't work for the TMF. The TMF should work for you. So I find you really have to be an active participant in using TMFs.
That was so well said. I love it. My next question was going to be, why do you think there are so many different theories, models, and frameworks in the literature? And you've partly answered that question already. But do you think that there are enough TMS, or are there too many? What would be your idea about that?
I think I'm probably in the minority when I say that I don't think there are too many. I think it can be overwhelming if you don't know how to go about choosing one, or if you worry that you're choosing the wrong one. But if you change the framing and think, I just need that these are tools, no tool is perfect. Sometimes you need to use multiple tools to get the job done. And to the extent that new TMFs offer more refined tools or additional tools, I think that's useful. Although I do think that there's a lot of incentives on scholars to develop new things, new TMFs, when we don't really need them, because, as scholars, we're incentivized to produce. And to the extent that we can talk across fields and decide maybe there are TMFs that are so overlapping that we don't need both of them. But, one of the overlaps that I've studied a lot is between the Consolidated Framework for Implementation Research and the Theoretical Domains Framework. And they're both intended to be comprehensive frameworks for understanding implementation. But one operates a lot at the individual provider level, and one operates a lot at the organizational level. I think both are very important. So we just have to be more thoughtful in how we select and apply them, I think.
And that is easier for somebody that's a little bit familiar with the TMS that are available to us. So I think that that's maybe one of the main takeaway messages from our discussion, is that you should dive in there and get to familiarize yourself more with what is out there, right? To be able to use them. So yeah, so I think that actually that's you and your colleagues a couple of years ago were a bit sorry for newcomers to the field, and tried to devise a tool to use to be able to feel a little bit more confident about the choices that you make concerning TMFs. Am I right?
Mm-hmm. Yes, that's right.
Okay.
And right, acknowledging, I think, hopefully, that there aren't really wrong or right answers. Just what we hope to encourage is some thoughtfulness. Per talked about the tendency of people to use a theory, model, or framework that is commonly used, because if other people have used it, then we can't be criticized for using it too. Which I think is okay, but the danger of that is that we all choose a suboptimal theory, model, or framework. Even if we're all together, doesn't mean that we're all right. So what I hoped for the tool was that we could encourage people to be more discerning in their selection, and be more confident in knowing that there are different considerations that they might make.
Exactly. So taking all kinds of things into consideration and listening a little bit to your own gut feeling, maybe that would be to sort of make some sense of what you just said. I think that maybe we'll go into a little introduction of what we as implementation scientists may be doing in our daily work, and then we'll get down to this tool as well and present it a little bit closer. And Sarah, please jump in when you see that there are things that are not completely clear when I'm saying them, or when there are students out there asking questions. We're doing this together. So the next slide is a little bit, sorry. So the next slide would be about a typical process for an implementation scientist to sort of follow. And it does look rather familiar, doesn't it? We would want to identify the problem. We would look at why this problem is existing out there. And maybe we would like to also do something about these determinants to make implementation possible using implementation strategies. But we need to test them as well. So we'll have to see if they're working or not. So this is sort of the situation one that Per was talking about this morning, I think. So we're going to follow this logic model, if I may call it that. And identifying the problem would be step one, and that would be looking at it quite closely. So somebody is not doing what somebody, a group of people, clinical people, the whole hospital is not exactly doing what they're supposed to. There's a gap in care. And I think that this example comes from your practice, Sarah. It's the use of a CT for low-risk microscopic hematuria, but it could be anything, right? Mm-hmm. So we'd want to look at why. Why is this happening? Why is this implementation not optimal? So what we're looking at in this situation are actually determinants, and our goal would be to have optimal healthcare, of course, but also to have a very good method or intervention intervented so that this outcome can be reached. So identifying the determinant of a problem could very well be done by using a determinant framework. And in this particular figure, we borrowed the design from a specific project. But I think we can all recognize that it's about the different determinants that we see in the sphere. We would want to look at, is it the intervention itself that's causing the problem of implementation? Is it maybe the characteristics of the individuals that are trying to adopt the intervention? Maybe it's about how this intervention was introduced or supported, facilitated, or it could be about factors in the inner setting that are maybe a barrier to implementing a particular intervention. And then when we have found determinants, we would probably want to measure how we would like to devise measures to see that things are getting better in order to see a better outcome for patients. So that would be sort of the logic model in some of our implementation scientists' work. Do you agree with that, Sarah?
Yes, and to clarify that, on the previous slide, there was a picture of a forest, and the idea was to evoke the idea of thinking very broadly about all potential factors that might be influencing implementation. And the idea in choosing an implementation determinants framework is that they tend to be very expansive in their thinking about what influences implementation. And the benefit of thinking expansively at the beginning is that we don't focus so closely on the things that are top of mind or that we are familiar with. We can think more broadly about all of the things that might influence implementation.
Yes, absolutely. So this is an example from also from something that you've been involved with when you were using a determinant framework called the TDF, and I think that Per has introduced it in his talk previously. And this is about the use of survivorship care plans for people with cancer, I suppose.
That's right.
And this is where, sorry.
Yeah, no, I use this example as a means of showing how you can think very expansively about factors that influence implementation of any intervention.
So the next slide showed a little bit about what you found when you dove under those crowns of those trees and looking at the determinants in this particular case. And had you expected to find these red factors from the start, or were some of them maybe a surprise?
Well, I think they were a surprise in the sense that the way the field had been thinking about it was very much in terms of individual provider behavior. You know, what were the providers doing wrong? Why weren't they doing it? Why weren't they developing survivorship care plans? And so in that sense, it was novel to find out, sure, knowledge of survivorship care plans is an individual provider factor, but there are other issues within the organization, like the flow of patients when they come in influences whether or not they get a survivorship care plan, but also things beyond the organization, like accreditation by quality improvement organizations influenced the adoption of survivorship care plans.
That's so interesting. So they actually broadened the view of what the implementation process, what would influence the implementation process later on as well. So it would give you an inkling, I suppose, of other things that you should target with your implementation strategies than you would have expected from the start.
Right.
Yeah, so consider your options carefully when targeting determinants with strategies would be an advice we both would like to give our audience. And as you had said before, maybe individual resistance to using care plans wasn't the problem, or maybe the knowledge of these care plans was not the problem. So taking for example, training or education as an implementation strategy will not help in that situation. So there is something that you could think. That's something you could think of when you are devising an implementation plan, is to look at these different determinants and match them with a strategy that fits. And at the individual level, there are psychological theories, and we've seen a couple of them already. And at the organizational level, there are also theories that you could use to get an inkling of what strategies could be used. So here are some very practical ways of getting into these theories. And I think it's up to our audience to consider very carefully what they need at this point in time. So let's go on and see what happens in the next slide. There are even more resources here, and there are different strategies strategies for mapping strategies with the determinants. So here are some different ways of doing that. And this is rather a meticulous process, isn't it, Sarah?
Yes, and I think that some are more meticulous than others. Implementation mapping is incredibly meticulous. It breaks down behaviors into the most minute steps, and then maps strategies onto each of those steps in a very, very rigorous way. In the same way, the behavior change wheel, takes factors that have been found to influence implementation and maps them very carefully based on psychological theories. But I tend to take a less rigorous approach, just to demystify the process a little bit or make it a little bit more accessible. Just using common sense to think about, let's say, an issue that influences implementation is that, that in a standard for accreditation, it stipulates that things be done in a certain way that is not conducive to implementation, then some advocacy to the accreditation body to change the way the standard is phrased, that's an implementation strategy. If there aren't enough staff to implement the intervention, hiring staff. This is can be very straightforward and not require any fancy tools, just to think about problem solving.
It is a lot about problem solving, but being very proactive at the same time. So I think that that's completely right here, that there can be a meticulous plan, and maybe it's a very simple thing that stops it from working. So thank you for that, Sarah. So this is more than observational research. This is actually experimental research, and I myself haven't been doing a lot of these types of studies, but these are very important to carry the knowledge development of the field forward. So this is step 4, and this is something that we could talk about for ages and days. So maybe not say too much about it before we go on to the choice or the selection of our TMF. What do you think, Sarah?
Yeah, I think that's a good idea.
So a couple of years ago, this is the publication that you and your colleagues provided our implementation science knowledge field with, and it has been very helpful to a lot of scientists in the intervening period, and it's still very much out there. So we'll just introduce it to you, and then maybe the audience can get into a closer examination of the tool itself in a little bit. So why do we have a theory selection tool? It's to assess the utilization of one or more theory, model, or framework in a particular project. And this is a direct answer to, the question that was on the table before. So this could be a resource for you if you're wondering, where am I going to start this? My thinking around this. And it was developed by you and your colleagues at the North Carolina Translational and Clinical Sciences Institute in Chapel Hill. And there are a couple of advantages for using it, and I think we've been touching upon them before, but one of the things we haven't been talking about a lot is that implementation science is a complex knowledge field, in that it is used in so many different healthcare and other contexts, which means that there is a real fragmentation in the literature. So using TMFs, using the TCAST rather, to choose a theory may reduce this fragmentation. Also, having this help of a selection tool would maybe promote the use of TMFs in the field. A lot of the times we see studies where people are using theory but not being rather too explicit about it, and then maybe we can't learn as much from each other as we could have otherwise. It also will facilitate transparent reporting, which is rather important, because when you do a literature search in implementation science literature, there are so many different terms used, and using terminology and criteria to select this TMF that we are united around is a very big plus. And also maybe using TMFs in the right way will be easier if you use this particular selection tool. So what does it look like? There are several domains that you may look at when you're using this tool, and it's thinking about your research project in the terms of familiarity, usability, testability, and applicability. So asking yourself the questions, how does this particular theory, framework, or model help me to realize my project? So, for example, usability is about maybe including relevant constructs. If you're researching, for example, self-efficacy or climate, you will be more inclined to use some theories than others. And maybe there will be a usability aspect concerning a figure. Maybe it's a good idea to use a TMF that has a figure that includes constructs and relationships among them, if you are into that. And maybe it's a TMF that provides an explanation of how the included constructs influence implementation and or each other. Then your TMF will be usable in your situation. Another thing that might be important to you is maybe how testable it is. So does the TMF provide me with testable hypotheses? Does it include meaningful explanations of relationships? And maybe the TMF also contributes to an evidence base because it's been used in empirical studies. Maybe that's an important thing for you to consider or to have as a reason for using a specific TMF. Another thing is familiarity. I think that we've been talking about that before. It shouldn't be the only reason for using a TMF is just because I've seen it before, but it could be a very important reason if your research context, where you're doing your data collection is comfortable with using a certain theory, and if it otherwise also fits your purpose, why not? That would be a plus to have people in the context being able to communicate with you about what your research is about. And then, of course, the last thing would be applicability. Is it relevant for my outcomes, for example? Does this particular TMF address a relevant analytic level, etc., etc.? So these questions will be asked in this tool, and you will be able to answer these questions connected to your own research project. And then by selecting first the characteristics of the project and then noting which TMFs might be interesting are already step 1 and 2 in your process. And then when you found some interesting TMFs, you could rate the fit of these particular TMFs for your project and calculate average scores and use them to assess the fit. So this could be repeated until you arrive at a TMF that fits your purpose, which is rather a systematic way of approaching the problem of selecting a TMF for your project. There's even a scoring part in the tool, so you could go a quantitative way and see, not only looking at the notes you've made while you're answering these questions, but also looking at total scores for different TMFs, which is helpful, I suppose. Is there anything you would like to add, Sarah? Because I'm going very quickly through this now.
No, you've done a beautiful job. Maybe I'll just say that we originally hoped that there would be some kind of computer algorithm that we could develop that would help people identify the most appropriate TMF for their project. And in fact, there is a tool out there. This second link, dissemination-implementation.org, to some extent does that, but it has a limited number of TMFs in it, and only so many criteria. So we're not to the point of being able to plug in the information or the criteria you might want and have a computer program spit out a theory or a model or a framework, but we hope that TCAST is kind of second best in terms of if it won't produce a specific TMF, it'll at least get you thinking about the criteria that should be used.
I think that's one of the main sort of advantages of using the TCOS is to start your thinking about what do I actually need and why do I need it, and what is most important in the project. So these are some links that our audience can use to get more acquainted with the tool, and also the different TMFs that are out there. So it's rather comprehensive. I went into this site yesterday and I was rather impressed. It's pretty good. I really like it. Okay, so we have a second half of the presentation, and this is on a more general level about using theory in implementation research. And we're going to go through the different ways of how to use theory in research. And maybe we'll have some time at the end to use to illustrate this process with some examples. And this may be familiar from other literature as well. But let's start with this figure. You've seen it before. It's about outcomes of different kinds. And at the very end of this logic model, there are client outcomes that we want to achieve with our implementation process. And in order for the client outcomes to be positive, we also need to organize our service so that this is possible. And if we have a good service, that would probably mean that we also have a very high use of evidence-based practice, for example, and implementation outcomes will be very feasible and true to their original design. They will penetrate in the organization and to a high degree. They will feel acceptable and sustainable, and there will be a high uptake at a reasonable cost of these evidence-based practices. So in these logic models, we want to look at implementation outcomes a little bit more concentratedly and link those to implementation strategies in our research so that we can have good implementation outcomes. So this is what the logic model that we want to follow when we are doing research in implementation science. So the goal will be important to keep your eye on, which is the ball that you need to always have in your mind when you're tackling implementation problems. But there will be problems to reach the goal, and we need new evidence-based practices all the time to get to better outcomes for clients. But then we need to integrate the solution in practice, and that is actually what implementation science is all about, is how to integrate the solution into practice. And this is sort of the key problem for most of us, is to select implementation strategies that are effective for reaching these good implementation outcomes. So this makes the circle complete. And in this particular picture, we see the definition of what implementation strategies are. It's an effort to modify the intervention, implementation context, the implementation process, and the individuals responsible for implementation. So this is what we do to get to good implementation outcomes. And this is stage 3, I think, in our previously drafted research process. So in order to get to the good selection of a implementation strategy, we need to think about where we are in our TMF selection process. What do we need? So that would be the first choice, as we were saying before. When we're looking at processes, we need process models. When we want to evaluate, we use evaluation frameworks, and maybe we want to look at determinant frameworks theories and implementation theories as well. But let me just see if I can go to the next one. The main sort of advice to give to implementation researchers is to explicitly justify their TMF selection, which is something we've been into just now. And then when you've done that, you can choose to integrate the TMF throughout the project. And these are the different ways of using TMFs, and I'll just go through them very shortly. Either you can use it to inform your research question, you could use it to design your study around, you can use it to perform your data collection, data analysis, and also to interpret your findings. So these different ways of using theory are actually, this is not unique for implementation science only, but this is of course something you can do with theories in other types of research as well. But we'll go through them from this viewpoint of implementation science here at least. So to shape the research question, in this case, I think this is an example from the research that you've been doing, Sarah. In what way was this research question informed by a TMF? Do you remember that?
Yeah, so this is actually not my research, and I don't know that this happens very often in implementation science, where you come to a research question based on a theory, but in organization science, this happens quite a bit. And in this case, let's see, is this contingency theory? I can't remember which theory, but oh, it's population ecology, which proposes that, you know, the bigger an organization is and the older it is, that the less likely it is to fail as an organization. And so the authors chose to study this idea with a case example of health maintenance organizations in the United States. I don't see this happening very often in implementation science, but I did want to just represent that some people do it this way, and that it would be wonderful if that started to happen a bit more in implementation science for the purpose of validating theories.
I agree with you. That would be extremely interesting, because we all invest so much interest in our theories, and we question them a little bit too little. So
yes,
that would be one way of testing a theory. You could use your theory or model or framework to guide your study design. And this is rather a complex picture, but it's about looking prospectively and retrospectively at implementation processes, and using your study design to mirror your question, of course. And that would be informed in this case by implementation theory. So that's way to look at it. And I think that, for example, RCTs are maybe not that much used in our science, because we are so sensitive to contexts differing between different organizations, for example. But it's not an impossibility. So you should look at both being able to maybe do observational studies, but also to look into doing experimental studies. And I think we need more of those to sort of further the knowledge field. What do you think, Sarah?
Well, I think your point about RCTs being of, you know, the less helpful in our field is right, because and this is just my opinion, but RCTs, the whole point is to isolate the influence of all other variables aside from the intervention, or in the case of an RCT of an implementation strategy, to understand the isolated effect of an implementation strategy. But as almost every implementation TMF suggests, implementation doesn't just depend on implementation strategies. It depends on the kind of complex interaction among the implementation strategy, the context, the intervention that's being implemented. So we don't want to control for all of these other characteristics. We want to observe that variation. So I'm much more interested in observational studies and implementation for that reason, so that we can make use of that natural variation, which is so influential in implementation.
Can
So,
I
yeah.
add? Yeah,
Yes.
I agree with Sarah. I think RCTs are not really suited for implementation research. It's a medical innovation, and if you have one active substance, you can test things. But I mean, implementation is so inherently multifaceted with the context that, and also we have this, I mean, RCTs at an individual level would be less interesting. It would be cluster RCTs, but I agree. But unfortunately, I think there is still this bias towards we should do RCTs, experimental studies, which I think provides less knowledge probably than observational studies. That's my thought.
Yeah, I think that this is a very interesting discussion, and maybe we don't have time for that. But there is, of course, the idea that we need to arrive at more generalizable knowledge in the field of implementation science, and doing quasi-experimental studies to study, for example, the impact of certain types of implementation strategies and compare them to each other in a little bit larger populations would be very interesting. But that's also my personal view. Yeah. So this is about the design of studies using theories, models, and frameworks. And then, of course, there are other ways of using theories. Shall we go on, or would you like to add some more, Per? No? He's quiet.
Yeah.
Yeah. Using the theory to drive the data collections, of course, is also a very interesting and very helpful way to gather more knowledge. And for example, you could do interviews using an interview guide, using a theory, so that you could, for example, in this example, look at constructs that are very well defined. And in this particular slide, I recognize the TDF, which has a lot of very well-defined constructs that you can use to base your interview questions on. And that's always very attractive to a researcher, to be able to reduce the fuzziness of our language and our conceptual understanding of phenomena. When you're doing a survey, that would be the same thing as well. So the survey items would be based on either an overarching construct, or on maybe even on a very detailed level, look at, for example, a determinant framework and follow that. So there are qualitative and quantitative ways to do a data analysis as well, and that's connected to what I just said before. So in for example, a qualitative interview mass of data, you could pick out deductively those parts that are part of your theory, the constructs in your theory. I'll give an example of that in a little while. Then, of course, when you're doing a quantitative study as well, you can model the variables in relation to each others, and you can also know which variables to include. And at the very end of this list of ways of using theory, you could use a TMF to guide the interpretation of your findings in your discussion section and connect your results to, yeah, what did my theory say, or what does a relevant theory have to say about my results? Let's see how much time we have to do these examples. Oh, we got a little bit of time, so that sounds good. I'm going to dive into example 1 now, which is about mobile health, implementation of mobile health. And this is a collection of slides that I should thank my colleague Christine Thomas for. She and I are in a project together about mobile health for young people in Linköping. In this particular case, we're looking at an example where mobile phone-based technology is applied, and the targets of this implementation objects are the parents and the pupils. And the implementers of this particular intervention are the child and school healthcare nurses. They use the strategy of information about the tool, and they supply them with this information in a school environment, so in childcare and in school healthcare at health visits. And the ultimate goal of the implementation process would be the use of digital tool in routine health visits, so that the children and the young people can benefit from what is offered in these mobile health applications, which is physical exercise and mental health support. So these health promoting mHealth or mobile health applications have seen some really promising results. For example, promoting healthy eating and physical activity, cessation of tobacco use, and reducing risky drinking, and promoting mental health. And then, of course, the different populations that are targeted are also important groups for the future development of our societies. So it's very important to look at how to implement them. But there are lots of questions about how to implement these mobile health applications, and these are the type of questions that are asked in this project. So what are the determinants for mHealth implementation, and how do they change over time? Can patients and end users contribute to mHealth implementation in healthcare? And maybe we would like to know more about how we can implement mHealth application in disadvantaged groups and, for example, immigrant populations. So this is the setting of this particular research project. So there are a couple of studies ongoing in the project, and it's about mHealth readiness, which is about how these different contexts actually provide a real world possibility of for implementing these techniques. And also the project wants to know what association there is between the readiness of the organization and the implementation outcomes. Then the role of the patients, or in this case, the young people themselves and their parents, how does that influence implementation? So, and also about how to look at the way that mHealth implementation changes over time. So there's lots of different questions in the project. So how do we use theory in this project then? There are two different large overarching theoretical starting points, and one of them you see at the bottom, and you've been introduced to that particular model already, or it's a framework rather. And my colleagues have been using this particular framework all through the research project, and also to design the interview guide. So they've been using it both to guide the data collection, but also to analyze the data. Another theory that we haven't seen on the screen at this particular presentation is the organizational readiness to change theory. So these are the two different overarching theories that have been used in this particular project. But why did they choose those? So actually, I think that most of the reasoning behind the selection of these particular frameworks was guided by the interest of the researchers in the research questions they had. And as you can see, a lot of these Sphere domains really fit into the questions that we've been just looking at. So there are a couple of publications available already if you want to check how these played out. And then I have a second example from my own research, which is a little bit simpler because we had an interview study with healthcare leaders in Sweden about the introduction of AI into their organizations. Then of course, we were very interested in understanding how these leaders actually looked at the implementation of AI in their organizations. What were their perceptions? What did they imagine that AI was all about? A lot of these questions were asked at a very early stage of implementation as well. And we needed to use terminology that would reflect their perceptions, but also be based in implementation theory. So we arrived at the same overarching determinant framework that you've seen before. But in this case, we decided to focus on the characteristics of the innovation itself, which is only part of this particular framework, because the Sphere is an overarching typology to develop our ideas about what works where and why across multiple contexts. And choosing one of the domains gave us an opportunity to really focus on what we were interested in, which is, to my mind, one of the most the best way to do a selection is to use your gut feeling, as we were talking about before. So we have the aim of the study to explore how leaders in healthcare perceive the characteristics of artificial intelligence as an innovation to be implemented into their organization. And then we did interviews, so we had a qualitative design, but then we used the Sphere framework as a deductive tool in the analysis of these interviews. And that was very helpful, I think. So we had this particular definition. The innovation in this case was AI. And the constructs that we choose in the Sphere, we motivated because they were based on conceptual and empirical support in the literature, which was a strength. They were consistent in their definitions, and they had a potential for measurement. So that was the reason why we thought that the Sphere provided us with a very good analytic tool. So what we then looked at were the 8 characteristics which were described in the domain characteristics of the innovation in Sphere. And I've illustrated them with these pictures. I think that some of you will recognize a lot of them. And they were helpful for us to analyze our qualitative material because they were so well defined. So what we did was take the Sphere definition of relative advantage and translate it, in this case, to the intervention or innovation of AI, artificial intelligence. So, for example, in this case, the perceptions of leaders about the advantages of implementing AI versus current solutions for healthcare organization and delivery. We defined the intervention source as the perception of leaders about whether AI is or will be externally or internally developed. Evidence strength and quality, we decided to translate into perceptions of leaders of the quality and validity of evidence supporting the belief that AI has or will have desired outcomes. Adaptability, the same thing here, that Xavier gave us a very good starting definition, and we rephrased it saying that adaptability would be the degree to which AI can be adapted, tailored, refined, or reinvented to meet the needs of different healthcare processes and work units. And in this way, we went on making our adapted the definitions from Saphir into our project context. And triability is one of the characteristics, design, quality, and packaging is one of the characteristics. And this goes on to complexity, for example, and costs. And having done so, having made these specific translations or adaptations or operationalizations of these constructs, made it possible for us to analyze our data. And I'm not going to tell you more about this study, except that you could go and look it up, of course, and check out the answers to this specific research question in our publication. So this is one way of using theory, implementation theory in research. I am coming to the end of our presentation, and I have some takeaway messages. I made them without consulting Sarah, so you're going to have to add to this, maybe, Sarah. I would like the listeners to our seminar to familiarize themselves with the literature, and not, if they can avoid it, inventing new TVNFs, if there are available ones that sort of cover your need. And use the TCAST or another selection tool to really see which type of particular TMF you need to be able to perform your research in a meaningful way. And then, of course, be explicit in your publication about the TMFs that you are applying. Use accepted concepts and definitions in your research, if possible. And maybe explore some more experimental designs when you get into the implementation research field a bit more. I agree with you, Sarah, that observational studies are a very good way of learning more about what works for whom and under which circumstances as well. But we maybe also need to go on and look at the mechanisms and why they work in different contexts. So that would maybe need a more experimental design. Yeah, and publish in implementation science journals where possible, just because we would like to gather more knowledge in one place. Make it easy to find your research in the future. Do you want to add anything?
Well, I guess the only other thing I would add is all of the phases of implementation research, from developing a research question all the way through interpretation of findings. I think that ideally researchers are using a TMF all the way through, and it provides a kind of backbone for the research. And creates a through line where oftentimes in the course of research, even in a grant application or a publication, things might feel disjointed otherwise. Having a TMF always brings it back, which is another very useful feature of TMFs.
Yeah, so the process doesn't become disjointed, as you said. before. I think that was a very good explanation of why TMFs are important in our science. Thanks for that. I think we can conclude with that particular sentiment. Thank you so much. We have time for some questions if there are any people out there that are mystified maybe even more by our presentation.
Thank you, thank you.
That would be terrible, wouldn't it? But no, but being a little bit confused is a good thing, right?
No, I think both of you have done a great job. So thank you very much for the excellent presentation. Especially, I really like the interactive presentation style. And let's see if we have any questions from the audience. So if not, maybe while we are waiting for questions that the participants are typing, I have one question. So traditionally in medicine or in public health, I think many people are quite obsessed with the design of randomized control trial. Very often it's being regarded as the gold standard of proving the value of a particular intervention. And of course, when you're doing implementation work, you will have to design your implementation intervention. And many will be asking, so how should I actually evaluate the value of your implementation strategies? You need to show me the evidence, and why don't you use an RCT design to tell me how well we're doing and what sort of value you have bring after all this assessment? So what is your take on that about the use of randomized control trial in proving the value of implementation strategies? Because I know that people have been talking about, the hybrid effectiveness research. They're increasingly using the RCTs in the field.
Yeah.
I'm happy to take an attempt at that. And I think Per was getting at this a little bit when he was commenting on the use of RCTs in implementation science. So RCTs are incredibly popular in the biomedical field. And that makes a lot of sense for interventions that are quite simple. Think about a pill. You put the pill into your mouth and you swallow it, and the influence of that pill can be isolated and should be isolated in an RCT. But we in our fields tend to study much more complicated interventions that don't rely on just one person taking a pill. It might rely on front desk staff and medical assistants and providers and managers, and they all must coordinate their efforts. And their coordinated action is very much influenced by the organizational culture and the resources that are available to them, and their own cognitions and limitations. And so you have all of these multi-level factors that are influencing outcomes, and it's very difficult to attribute outcomes to the intervention when we know that the intervention involves the coordinated use of all of these people who are in turn influenced by the environments in which they work. And so isolating any particular component of that, it's just cognitively very difficult to imagine the relevance of isolating the intervention from all of those different things. Seifer does a nice job of that visual representation of how all of these different things influence implementation, and disentangling them it is near impossible. So that's my perspective on the question.
I can add. I totally agree, and I think to some extent we are sort of burdened by our evidence-based medicine background. It emerged in sort of healthcare or health services research, where this ideal is strong with RCTs, because I consider our field more of a social science, where you sort of recognize that everything is sort of interrelated and more complex relations and the context not least. So yeah, it seems like, for example, the implementation science, the journal is actually gone maybe in a more medical direction, because but on the other hand, there are other journals now, I think, so the field has some acceptance that I think we will never be able to say and generalize in much detail that this strategy is always working, because it will depend on the context and circumstances, etc. So yeah, I guess we have to accept, but I haven't done any RCT in implementation science.
And as a person who do traditional RCT and being formally trained in evidence-based healthcare, I do have reservations about using RCT for implementation science, because when we evaluate relatively simple intervention, just like taking a medication, we'll be able to generalize the result to other populations. So let's say if I've done RCT in Hong Kong, it may be generalizable to population in Guangzhou, in Shanghai, right? So the value of doing RCT is to transferability of the conclusion to potentially other population. And of course, if you can do multi-center trials, then you have even more credibility. But then in implementation science, we know that the culture, the organizational climate, the health system architecture is going to be different in different sites. So even though you can prove the value of your complex implementation strategy in one particular healthcare system, it may inform nothing in other healthcare systems, because all these contextual factors is very different. So the whole point or major value of RCT is relatively lower when we are trying to do RCT in implementation science. And I do think the opposite is true. You have to have more mature theory so you can have more comprehensive understanding of the whole phenomenon. So when you're trying to make policy or design and implementation, you have a more in-depth understanding, though the probability of success may be higher.
I saw that we got a question, Vincent.
Yeah. So yeah, one of the audience is asking, it is kind of hard for her to distinguish outcomes in implementation science. So you have implementation outcomes, service outcomes, and also client outcomes. And she would like to know a bit more about that.
I think we could recommend them to read Enoda Proctor's paper, or Margit.
No, I was going to say that that's a very good suggestion. The whole description of these different types of outcomes will be clearer when you read that article. In general, you could say that you're looking at outcomes in different groups of people, right? Not only people, but also organizations. So client outcomes would be, for example, health outcomes in patients. If you implement an evidence-based intervention in an effective way, the health outcome for a client has a higher rate of effect. It is more effective for patient health. So then you would be measuring patient health as the end outcome, which is a client outcome. But in order to do that according to Proctor, you need an organization that is also able to provide this treatment to the patient, which means that there are service outcomes in the shape of, for example, accessibility. You don't have to wait 3 years to get your particular evidence-based treatment. So that would be an outcome at the organization level. And then the implementation outcome is what we did, what strategies are successful in making staff change their behavior and use evidence-based practice. So if they find that this EBI or this evidence-based intervention is something that they can provide within the space of time they have, for example, in their practice, that would make for a very good implementation outcome. Then it would be feasible, right? It would have a high feasibility. So there's different type of outcomes at different levels, the client, the service, and the staff level, so to speak. And that's the differences I see them, at least. So that would be in my simple words. Yeah, I don't know if that made anything clearer.
Yeah, I think yes, I think it did. But reading that paper is crucial, I think. Actually, interestingly enough, Proctor was part of our course last year, I think, and she talked about adding another implementation outcome, which would be equity, which is very much more in focus. To what extent has the implementation had an effect on that? So I think they are working on a revision.
There's a new paper out there already. I haven't had time to look at it so carefully, but there is a 2023
Okay.
paper as well.
Yeah, it's difficult to keep track.
We're not keeping it.
Okay, so if there's no more questions, then thank you very much for Professor Nilsen, Professor Birken, and also Professor Neher for delivering such an excellent presentation to us tonight. So thanks very much for joining for the first seminar of the Implementation Science series. See you tomorrow at the same time, of which we will have 3 other lectures on the practicalities of doing implementation science research, featuring Professor EKO, Professor Janet Crick, and also Dr. Julia Moore. So see you tomorrow. Bye-bye.